presentation today is an audio-only webinar. So in order to ask your questions, we ask that you please use the Q&A function in the upper right-hand corner of your WebEx screen. You'll want to make sure that you click on that blue icon to make sure that it's activated so that you can use it throughout the presentation today. We will hold questions until the end of the webinar, and we'll ask the questions in the order of which they are submitted. We do ask that you keep the questions to the content of the material that's covered in our presentation today, and we will make the slides and the frequently asked questions available from this webinar on the MMS website, and that information will be provided later in the presentation on the reference slide. So CMS is committed to engaging with healthcare stakeholders to help in the understanding of the quality measure development process. They look for feedback that can provide guidance on the creation and implementation of resources that will help those who are interested in measure development to better understand what is happening as measures are developed. To date, CMS has implemented an education and outreach webinar series and resource materials to break down and explain various components and challenges in the measure development process. They have also dedicated websites, listservs, and roadmap documents that are to support those that are interested in developing measures or wanting to learn more about how it is done. In order to best serve you, we want to make sure we learn about our audience today. So we do have a few poll questions that we would like for you to fill out. The poll questions will appear on the right-hand side of your WebEx presentation. So Martin, if you're able to go ahead and do that. The questions that we'll go over with you today, we just want to make sure that we understand our audience so that we make sure that the materials we provide to you are geared towards the needs and the experience level that you have with measure development. So we'll first ask what your role is with quality measures. Some of you may report on quality measures. Others of you may be developing them. And so we just want to have an understanding of where you fall on the spectrum so that we can make sure the materials we develop are appropriate for you. We also want to know what your experience level is with the measure development. We offer a variety of resources that span the measure development experience levels, but we're always working to identify gaps and where more resources may be needed. So you'll see now these poll questions along the right-hand side of your screen. So if you can go ahead and start filling those out. They'll be made available for about 5 minutes, and so you can take the time to fill those out. We're also going to ask if you receive any of the current outreach and education newsletter information. If you aren't sure or if you don't receive that information, we'll have the availability to sign up for that listserv at the end of the presentation today. And then we're also wondering how you heard about this webinar, because as we increase our efforts in engaging those that are interested in measure development, we want to make sure that we're getting any pertinent updates and information out to you through the appropriate communication channels. So again, as you're working through these questions, we appreciate your feedback and your information, and I'll now go through the agenda for today. So during today's presentation, you'll get an introduction to CMS and the quality goals, as well as an overview of the CMS Measures Management System. We'll then discuss how quality measures are used, the process of how they are developed, and what the life cycle of the measure is like throughout the entire development process. We'll review the regulatory processes that are mandated for inclusion of quality measures in some of the CMS quality programs, and how you can get involved throughout the measure development process. And lastly, we'll have CMS talk about the Meaningful Measures Initiative that identifies the highest priorities for quality measurement and improvement. So I am pleased to welcome our 3 presenters today, Ms. Golden Horton and Ms. Kimberly Rawlings of CMS, and Dr. Nicole Brennan of Battelle. And Battelle does serve as the Measures Management System contractor to CMS. So we'll kick today's session off with an introduction by Golden Horton of CMS.
The public and the work CMS is doing around quality measurement. We aim to shed light on the processes and function of quality measurement in CMS programs and initiatives. If you're new to quality measurement, please stay tuned for available resources that can help navigate development and use. And now I will turn it over to Dr. Nicole Brennan, who will discuss measures management.
Thank you, Golden. We are going to start at the very beginning and just define really what is the measures management system. So CMS established the measures management system as a way to help standardize a process for developing, implementing, and maintaining quality measures. So I want to note here that there is a difference between quality measures, quality improvement, and quality assurance. And today we're really going to be just focusing on that clinical quality measures aspect. So there are a couple of key components to the measures management system. The first is creating tools to assist in the development of clinical quality measures. And the second is to engage stakeholders such as patients, clinicians, clinical specialty societies, and patient advocacy groups on how to get involved in the quality measure process. So tools that have been developed include the Measures Management System Blueprint, the CMS Measures Inventory tool, and our newly redesigned MMS website. The MMS website helps to facilitate our engagement, including a place to sign up for our MMS newsletter, as Mary mentioned just a moment ago. So while you're on the website, you can locate the MMS Blueprint, and when you first open it up and note that it's 376 pages long, it can seem like a very daunting document. But it really is not designed for you to read from front to back, but it's to be used as a guide to measure development throughout the entire process. So I'll say it's broken into 6 sections, and section 1 and 2 combined are only 30 pages long and really are there to provide you with a high-level overview of MMS and the measures management lifecycle. So section 3, though, is quite long, but that is a deep dive into a number of different topics, including person and family engagement, how measure developers can better engage family members or patients into the development process. It talks more about measure testing and really getting into the nuances such as risk adjustment, and then how do we evaluate a measure and make sure it's still usable and meaningful to the public. Section 4 provides tools and forms to help people develop measures, and then 5 is just a glossary of terms, and 6 is the appendices. So what is a clinical quality measure? So measures are quantifiers of processes and outcomes, patient perceptions, and organizational structures. I just want to give an example of what an organizational structure and a measure might look like. And so that might be asking the question, how many healthcare organizations are using electronic health records? That's the structure of the healthcare system. So quality measures overall are associated with our ability to provide high-quality care, and they are supported by both empirical and practical evidence. So we do a lot of research into the measure, and then we also engage our stakeholders to make sure it is practical in practice. There are a number of centers throughout CMS that use clinical quality measures, as well as programs within those centers. Programs can include like the Home Health Quality Reporting Program, Hospital Inpatient Quality Reporting, Merit-Based Incentive Payment System, which you may have known as MIPS, and Hospice Quality Reporting. Really the takeaway message there is that measures are used across the entire healthcare spectrum, primary care, post-acute care, hospitals. We try to make measures so that we are evaluating the entire system as a whole. At a really high level, what's the purpose of the quality measure? The measure is a tool for making good decisions. Okay, so now we need to define what is a good decision. We define that as one that makes it more likely that the user of the measure will experience a good result. And at the same time, you're less likely to experience an adverse event that you did not expect. I do want to highlight here that there is the definitions of probably and likelihood here, which means a measure does not guarantee the experience of a good result, but is meant to get us closer and standardize the process to getting to that. So how does the measure affect decision-making, and how is it really relevant in clinical practice? I'm just going to ask you to bear with me for a moment on this slide. It's an older graphic, but it's one that has held up really well over time. And the point here is to help you see that there are actually a lot of steps that we go through before we ever develop a measure. We should not just see a problem and immediately think if we develop a measure that will fix it and everything will go right in the world. We really have the systematic process of getting to the point where we're ready to develop the right measure. So I want to start both at the beginning and the end with the outcomes. First, a clinician might see room for improvement in health outcomes. And I want to just use the example of concussions as we go through this cycle. So we saw a need for more medical attention to concussions. Previously, concussions were just sort of thought of as a rite of passage to playing sports, or that someone could recover very quickly, and we didn't recognize the adverse and negative health outcomes that could result from concussions. So we did a lot to develop guidelines around treatment of mild head trauma. But now we are coming to the concept that potentially more people than necessary are getting medical treatment such as CT scans or MRIs for mild head trauma. So there we have our concept, which is some insight into the system that we're working in. And it's also combined with what we know about patients, what we know about that specific condition, and how we conduct research in order to validate our ideas. So that would be the next step. We would go into clinical research and look at concussions and what treatments are currently being offered and how often they should be offered. And the third step there, we take all of that research and we analyze and synthesize it, and then we develop a guideline based on it. So for example, a guideline was developed related on when we should and shouldn't conduct a CT following mild head trauma in children. We then incorporate those guidelines into what's called a clinical decision support tool, so that we have the pediatric head trauma tool. And those guidelines are used to inform our clinical decision-making in actual practice. So now we want some way of evaluating whether or not we're using these recommendations, and we develop quality indicators. And this might be where quality improvement and quality assurance happens within your practice. In an ideal world, for every clinical decision, there'd be an indicator based on that guideline that would tell us if we are using the guideline. We know in practice that you can't always implement the guidelines step by step, but this is meant to really help standardize those steps and improve health outcomes. So once we have these indicators and metrics, we are interested in looking across the entire nation or the entire spectrum of the healthcare system, and we might develop a performance measure. So here we have the CMS measure on emergency department utilization for CT scans in minors with head trauma between the ages of 2 and 17 years old. Gotten pretty specific there. We're looking at a very specific population in a very specific setting. So a performance measure is all about standardization, benchmarks, and thresholds. Ultimately, what we care about is those outcomes. We want children who need CT scans to get them and prevent further injury, and we want children who don't need them to not get unnecessary procedures. So how does equality actually improve through the use of these measures? There's really two ways we can get to that. They're called selection and change. So selection involves moving populations of patients from low-performing clinicians to high-performing clinicians. We report on how the clinicians are doing, and the patients make a choice on where they want to receive care. And if you do that, the average outcomes should improve. And then we have change, and change would involve individual clinicians moving from being a low performer in a specific area to being a high performer. And again, to the degree that that can happen, our overall health outcomes will improve. So let's dig in just a little bit more into what is involved in a clinical quality measure. This slide is showing all the components of the measure, and that is really here to help answer questions like what is the decision we're trying to make, even really down to something as basic as does the title of the measure provide good information on what the measure is actually supposed to do. And here we would start developing our numerator and our denominator. What populations of patients are we looking at, and really who might be excluded from that population and why? There's something that we call the measure life cycle. And if the measure life cycle was a linear process, this is what it would look like. The life cycle starts with us developing our concept around a measure, developing those specifications, testing it, implementing the measure, and then going through evaluation and maintenance. It's important to note, though, that the measure cycle is not actually linear. If we're doing it right, we are testing during the conceptualization stage, testing during specification, trying to make sure that we are being very iterative in the process so that if a measure is going to fail, it would fail very early. And if it was going to succeed, we would also begin to see how it was going to succeed very early as well. And most importantly, through each and every one of these steps, we want to be engaging our stakeholders. We want patients' input on what measures are meaningful to them. Clinicians, we want to know what measures are usable for them. I want to just run quickly a little bit more in depth into the steps. So measure conceptualization, here's where, again, we really start to develop the case for why a measure should be developed. You know, what's the science behind the condition? We review all the other measures that are already out there. We review recommendations that have been made on what measures should be developed. And we try and gather as much stakeholder input as we possibly can. This is a great stage for you to get involved in the measure development process. By informing a measure during measure conceptualization, you can really help make sure that in the end, that measure is as meaningful as possible. Again, measure specification, really where we're beginning to flesh out those details. Where are we going to get the data from? Maybe what ICD-10 codes are we going to use? What claims will we use? Are we going to do surveys of the population? What settings do we want our measure to be in? And then we get into measure testing. So we can split this into two phases. We have our alpha testing and beta testing. So alpha testing can occur as early as the information gathering process and is repeated over and over. So here, that includes methods to determine if individual data elements are available and if the form in which they exist is consistent with the measure. So it's very hard to implement a measure if you can't actually collect the data for it. Beta testing, which we also call field testing, generally occurs after we've gotten through the specifications, and it happens on a larger scope than the alpha testing. In addition to gathering further information about feasibility, the beta tests serve as a primary means for also assessing if the measure is scientifically sound and if it's usable in practice. Implementation really includes a number of things, but here I want to kind of focus in on the rulemaking process, which we're going to talk about a little bit more. This here is another really critical stage for stakeholder engagement. We develop work groups, we have technical expert panels, and we have public comment. So implementation is really a time when stakeholders can look at a specific measure that's being proposed and make comments on that measure. So measure use, continued evaluation, and maintenance really should not be seen as the final stage of the measure life cycle, but as the stage where the measure is routinely being reviewed for usability, burden, feasibility, and the value to the patients. As needed, measures should be updated or even retired from a CMS program based on how they are being implemented in practice. So I know I saw a question already about what is the MMS website, and here is your answer to that. You can actually easily get to the CMS MMS website by just Googling CMS and MMS together. I tried it several times last night. It'll get you right there. We also have our other tool, which is the CMS Measures Management System Inventory tool. So we have CMIT, it's the CMS Measures Inventory tool, so cmit.cms.gov. If you go to the website, you're going to see that we've split it out through 6 categories across the top. We give a basic overview of what MMS is, more information on how to develop a measure, a lot more specifics on how to get involved, provide tools and resources for both general public and measure developers. And we also have a link just for new measure developers, and then our series of popular links where you can get back to that inventory or to the other CMS programs that you might be interested in seeing. So in a minute, we're going to talk a little bit more about getting involved, but the takeaway message is that the measure development process really has a role for everyone. We want to make patients understand that they can be part of technical expert panels. While it has the name technical expert panel, nobody is more of an expert in healthcare than the patients. We also really welcome public comments to the measure development plan and to measures as they're going through rulemaking. Here you can also find a link to the MMS listserv, which we will send out to you monthly, a newsletter, and in that newsletter you'll see articles that explain more about measure development, but also let you know of additional ways you can get involved. So here is the CMS Measures Inventory tool. So over the past 3 years, CMS has transformed the measures inventory from a spreadsheet that contained over 10,000 cells of data to an interactive web-based tool. CMIT was really developed to increase the usability and transparency of the inventory, and I'd highly encourage everyone on the call to just take a look at it after the call so you can see what is entailed there. When you go to the website, you will see a full listing of every measure that is currently being implemented in CMS programs. You'll also see measures that are being proposed to be used within the next couple of years. You will also see measures that have been retired or measures that are still under development. If you were to click on a specific measure, which measures can be sorted by their condition or keywords within the measure. You can also look at measures based on their NQF endorsement status or what type of measure they are. And once you find the measure you're looking for, on the first page you'll see all of those specifications that stay with that measure no matter what program is implementing it. If more than one program is implementing this measure, it should have the same numerator and denominator within those programs. Once you can go down that line and you'll see the tab for programs, that's where you'll see specifically how the program has sort of categorized this measure and what stage it is in within the program. So is it being used right now? Do they plan to use it in another couple of years? And then we have links to all of the rules that establish the measure and oftentimes the specification documents related to the measure. So trying to put everything in one place and as usable as possible for you to find more information about clinical quality measures. So not all measures are part of rulemaking, but there are a number of programs that require a measure to be published within the federal rule before they can be implemented within the program. So the first step of that process is what's called pre-rulemaking. So each year, CMS gives measure developers the opportunity to submit measures for consideration by the 18 quality reporting and payment programs. So measures are reviewed by a CMS staff, and those that are selected to move further in the process are published in what's called the Measures Under Consideration, otherwise known as the MUC list. So these measures then are further reviewed by the Measures Application Partnership, called the MAP. Work groups within the MAP look at the measures and provide CMS with sort of their assessment and recommendations based on the measure. At which point, CMS may seek additional public feedback by publishing a measure in a proposed rule. So each program releases twice a year what's called a proposed rule and then a final rule. In the proposed rule, they will list out measures that they are considering to add to the programs or measures they're considering to remove from the programs. And this is another great opportunity to get involved. You can go on to the federal rule website and add comments related to measures. And before the measure goes to final rule, CMS reviews all the public comments. And then when you read the final rule, you'll see that they answer to many of, if not all of the comments that are made, and then come to sort of a final decision on if the measure should move forward or not. And many times the comments will influence a measure to not be put into the program. And other times such accolades are made or need is met that measures go into the programs. So as is our theme today, how can you get involved? So participation in the TEP, which again is the technical expert panel, providing public comments or even developing new measures yourself that can be help you become actively engaged in the measure development and implementation process. We'll go into this a little bit more in the second part of our series, which we'll be holding in a couple of weeks. But we want to just touch on how a measure is assessed for inclusion. What we're always looking for is the ability for the measure to be implemented not only in a pilot setting, but we want to make sure that it will work across the country. We want the measure to be usable, and we want the measure to ensure that it's harmonized, that it's not in conflict with other measures that are already there, or that the specifications potentially are harmonized between two similar measures so that clinicians are not having to use two different tools for the same condition type. And most importantly, we really want to make sure that the measure is meaningful, which Kim Rawlings will talk more about right now. Kim?
Thank you, Nicole. So my name is Kim Rawlings, and I'm from CMS, and I'm going to provide you an overview of the Meaningful Measures Initiative. A primary goal of the CMS administration is to remove obstacles that get in the way of the time that clinicians spend with their patients. We realize that this is incredibly important, precious time that is often not long enough, and so we want to try and optimize that. One method is by reducing regulatory burden. Of course, we know that some regulations are good, very necessary, and really promote the health of the population. But at the same time, we realize that there might be some areas for improvement. And so we've decided that this is a really good opportunity to try and study and evaluate what we can do to try and improve the state by reducing regulatory burden. So for quality measurement that we're speaking about today, this has led us to develop our Meaningful Measures Initiative, which is guided by CMS's 4 strategic goals that you see here: empowering patients and doctors to make decisions about their health care, ushering in an era of state flexibility and local leadership, supporting innovative approaches to improve quality, accessibility, and affordability, and last but not least, improving the CMS customer experience. And so each of these goals really informs meaningful measures. We recognize that there are too many measures. It's difficult sometimes to understand how these measures fit together, which can lead to a lack of focus, and that overall there is an administrative burden of reporting. And so through the Meaningful Measures Initiative, we're really taking a look and a new approach at evaluating what we do. So as we begin to look at our measures approach, we're talking about a number of objectives that we're considering as we evaluate our measures, look for gaps, identify top priorities, etc. A main goal of Meaningful Measures is to focus everyone's efforts on the same quality areas. So I won't go through each of these specifically, but to highlight a few, we want to make sure that we're patient-centered. We want our outcomes to be based on high-impact measures that are relevant. We want to make sure that we're looking for areas where there are opportunities for improvement, and we want to make sure to address measures that are value-based, and most importantly, make sure that the measures that we're selecting align. And at CMS, we really view ourselves as having the having unique opportunities to continue to guide real measurable improvements for the entire nation while also encouraging the use of a more parsimonious, or in general, more parsimonious measure sets, while still working to reduce the burden of measurement. So with the help of our partners, we've identified key common quality issues to focus on. CMS introduced a comprehensive approach using the Meaningful Measures framework to identify the highest priorities for quality measurement and improvement, and to assess the core issues that are most critical to providing high-quality care and improving individual outcomes for our patients. Of course, because of the scope of this work and just in general the transformative nature of this initiative, we cannot do this alone at CMS. We cannot achieve this in isolation or in a silo, and so the Meaningful Measures framework really draws on work and, measures work and various perspectives from experts and external stakeholders that you see here. These bodies of work and stakeholders really provided us the basis for developing criteria around measures being meaningful to patients and, having these be really actionable for providers. And so here is where we have put pen to paper and in very small font, but I'll tell you where you can find more details and larger font in a few slides. But this is our approach. This is the Meaningful Measures framework. So at the center, you can see the patient is right there where he or she belongs, along with our 4 strategic goals. And these strategic goals connect to the 6 cross-cutting criteria, which you can see kind of around the circle. So eliminate disparities, track to measurable outcomes, safeguard public health, achieve cost savings, improve access to rural communities, and last but not least, reduce burden. These cross-cutting criteria serve as desired outcomes that CMS and our partners really believe are critical for improving the healthcare system. Shown pictorially in the circles, in the little circles around, and then in bold on the right, there are 6 quality priorities. Hopefully these are fairly familiar to you and you'll be able to recognize them. But 6 quality priorities along with their 19 meaningful measure areas that also track to the cross-cutting criteria by working to support those desired outcomes. So for example, we have a cross-cutting criteria of achieving cost savings. So how would we do that? We can look to the quality priority on the outside of the circle of making care affordable. This quality priority has 3 meaningful measure areas: appropriate use of health care, patient-focused episode of care, and risk-adjusted total cost of care. So by focusing on these meaningful measure areas, such as appropriate use of health care, we can work towards the cross-cutting goal of achieving cost savings, ultimately meet our CMS strategic goals, and again, all of this with the patient and provider in mind. So let's examine one of the meaningful measure areas to see in a little bit more detail how this framework functions, and you'll see there are some examples of measures, etc. So one of the 6 quality priorities is the prevention and treatment of chronic disease. It has 5 meaningful measure areas that you'll see. So preventive care, management of chronic conditions, prevention, treatment, and management of mental health, prevention and treatment of opioid and substance use disorders, and finally, risk-adjusted mortality. And then just to the right, under measures, we have examples of measures actively in our programs that would fit into each of these meaningful measure areas. And so each quality priority and their respective meaningful measures will guide the reduction of reporting burden on providers while focusing quality improvement efforts on only the most critical areas. And we're doing this by the adoption and evaluation of the most meaningful quality measures to drive better patient outcomes at lower costs. So one of the questions that we've received several times since this has rolled out in October of last year is, how do meaningful measure areas relate to existing CMS programs? The Meaningful Measures Initiative is not intended to replace any existing programs, create any new requirements, or mandate new measures. Again, this is about burden reduction and getting to the most meaningful measures possible, not creating additional requirements or work. And so the purpose is to really to use this framework to really help programs identify and select individual measures and increase measure alignment across programs. And of course, we're working with other public and private initiatives as well to hopefully align even across payers. We want to make sure that the agency is pointing to high priority areas where there may be gaps in available quality measures, and that'll help CMS help guide, I guess, CMS's efforts to develop and implement quality measures to fill those gaps. So that was a quick run through. Obviously, there are 5 other quality priorities and 13 other meaningful measure areas. So you might be wondering, how do I find out about these measures? So we recently launched a Meaningful Measures website that serves as a hub for all of this information. It includes information on what this initiative is about. There are several videos you can watch, lots of fact sheets, Q&As, and of course more detail on the 19 meaningful measure areas. As I stated before, we definitely cannot do this in isolation or in a vacuum. So we welcome your feedback and thoughts and perspectives on this, and the email where you can provide us that feedback is on the website as well. As someone who answers those emails, I can guarantee you that we respond to everyone, and that we do read all of those emails and comments. So I really encourage you to check out the website, learn more about it. The CMS Measures Inventory that Nicole mentioned earlier contains the meaningful measure areas for some of our measures. We're working to incorporate that field, so you can find more information there as well. And so with that, I will pass it back to Mary to wrap us up and see if we have time to answer some questions from the Q&A in the chat box.
Great. Thank you so much to Golden, Nicole, and Kim for your time and the information today. And throughout the presentation, you will have heard about a variety of the resources that are listed here on this reference slide. And these are all available for you to learn more information. The links to these resources on this slide, you'll be able to access this slide information on the MMS website in the next couple of weeks. And so feel free to access those as well as a variety of other webinars that we've provided and the tools and resources that Kim was just talking about. And so with that, we will go ahead and start with our question and answers. And so we have been getting some questions throughout the presentation today. So we'll start from the top and work our way through, and you can continue to ask questions, and we'll be capturing them through the Q&A function as we go on. So our first question, Nicole, this is aimed towards your part of the presentation earlier. At what stage would NQF endorsement occur?
Great question. So that would occur during that implementation phase when we're going through rulemaking and getting all of the stuff, all of our sort of research pulled together. That's when you can also go through the NQF endorsement phase.
Okay, great. Thank you. Another question that we had was about if there's a process to contest a measure, if there's new evidence that would suggest that maybe a measure might not have as impactful as an outcome that was initially thought.
So I can start with that, and then Kim, if you have additions, we'll welcome that as well. So like I mentioned, the programs have their two rules. There's a proposed rule and a final rule. And during the proposed rule session, many times the programs will list all of the measures that they currently have, and or they're open to those public comments related to any measure that's currently within that program. So you can use that opportunity during the proposed rule public comment. And then there are other places within the MMS website. There's a section for public comments, and oftentimes programs will open up to just comments around specific areas or measures or things that they're thinking about. If you go there, you can see what programs are currently accepting comments. And then you can always, utilize the various help desks or the MMS support center for submitting comments that way, and we can get those over to CMS.
Okay, thank you, Nicole. And then we had a question specific to the CMS inventory tool, and the question is about how that inventory tool might be different from the ECQM library website.
Okay, great question. So the CMS tool, it comprises all the measures across all of the CMS programs. What you'll see on some of the specific websites, the ECQM library or on the MIPS website, they will list the measures that they're currently using within their programs. We were just trying to develop a way that you could sort of go to one place and see all of those measures, and then to potentially see which ECQM measure is being used across numerous programs, or if a MIPS measure is being used by other programs as well. So CMS is really about just creating that one-stop shop for all of the CMS measures specifically.
Okay, thank you. And then another one specific to the inventory tool, again, Nicole, are measures being developed by societies available in the CMS inventory tool?
So if the measure is being developed by a specialty society and has been submitted to CMS to be implemented within one of their programs, yes, absolutely, it'll be part of the CMS tool. If it's being developed by a specialty society and has not been submitted to CMS, then at this point it would not be included in the tool.
One of the questions that came in is from someone that's new to quality. So for someone new to this area, what is the best way to learn about measure specifications and how to read, interpret, and ultimately understand them?
I certainly think the very first step might be to go to that website and to look at the section that's called New to Measure Development. Check that out. That'll give you a real high overview of what measure development is, and then you can start to dig a little deeper. You can go into the blueprint, and like I said, those first two sections really are about what measure development is and what a measure life cycle is. And then, as you become more involved in measure development, the rest of the blueprint is really meant to help guide you through that process. And then we try to offer opportunities throughout the year to engage you measure developers further and to increase your knowledge around measure development.
Wonderful, thank you. And then we are going to switch over to a question that came in about the meaningful measures. So Kim, for you, did the meaningful measures replace MIPS or is it in addition to MIPS?
Thanks for that question. So the meaningful measures isn't a program or like a requirement or anything like that like MIPS. So it's not replacing MIPS. It's not in addition to MIPS. It's more of a framework that CMS is using to try and make sure that our measures are as meaningful as possible. So it's a framework that's making sure that we are prioritizing our measures and that we're putting those priorities out in the open and being transparent and saying these are the 19 areas the 19 quality improvement, quality measurement areas that we are really focusing on right now. And so we're using those areas to help tell the story of why we have the measures, why the measures in our program are there, but we're also using the framework to evaluate whether a measure belongs in there. If a measure doesn't follow one of our priorities, one of our 19 meaningful measure area priorities, and it's not statutorily mandated in some way, then that's a measure that CMS would consider removing. So again, it's not a requirement or a program, but more of a way to evaluate, or a way for CMS to evaluate and think about what measures are most meaningful so we can better prioritize, and through that prioritization, reduce burden on clinicians so that they can have more time with their patients.
Okay, Kim, and I'm going to stick with meaningful measures for another additional question that came in about them. So will meaningful measures be offered with e-specifications so that they can be reported electronically?
So that's, so meaningful measures isn't something that would be reported on, but more something that CMS would identify with that measure. So, for example, if you are familiar with like our muck list, or reading any of our rules, things like that, the rules just as the one that just came out, mentions meaningful measures. So it's not, a meaningful measure area is going to be assigned to our measures going forward and to the measures in our program. However, there's no additional action, burden, anything like that on the side of the provider or the patient. It's really just an assignment or a classification that CMS is using for that measure. I hope that answers the question. If not, please feel free to submit again, and I'd be happy to try and answer.
Okay, great. Thank you. So a question that came in, Nicole, this is back to your topic earlier, specific to the blueprint. And the question came in about when the blueprint update will be released.
Sure, and I can actually let Kim chime in on that. I know that we are actively working on it. So, Kim?
Yep. So, version 14.0 of the blueprint will be out mid to late summer of this year, of 2018. And it will include, some language and examples and explanation and everything of meaningful measures. So we will be incorporating meaningful measures into the blueprint in this next rendition. Typically, it's updated once or twice a year with a smaller, minor update, and then we do a large update, usually somewhere in the spring, summer.
Okay, fantastic. Nicole, I think this one comes back to the life cycle of measures. So can you address topped-out measures, specific the life cycle of them, the approach to decommission them, et cetera?
Sure. So from a high level, topped-out measures are measures that CMS has decided to sort of retire from a program because they have sort of reached their maximum ability for improvement based on sort of whatever indicators we're looking out for that measure. The approach to retiring, decommissioning, or listing a measure as topped out is the same as putting a measure into a program. So it will be introduced within the proposed rule and then also go through public comments into the final rule. Kim, is there anything you'd like to add about topped-out measures?
No, I think that was a great explanation. Thank you.
Okay, and then we had a question from someone that is an individual community provider, and they're wondering, based on their role as an individual community provider, what can they do to be a part of the conversations to contribute to the development of measures?
Great question, and something we certainly hope that you can get involved with. There's lots of different ways and of varying different time commitments. So if, as a provider, you think you might have time to be part of a technical expert panel, which again, when those are published, as you would also see through the MMS newsletter, they'll tell you exactly how much time they think you would have to commit to being part of that technical expert panel. All the meetings might be via webinar. There might be some in-person meetings. So you just want to kind of look at those. And there's also opportunities to provide public comment around the measure development plan, sort of what is meaningful to you. And then again, through the public comments period within the rules. So if you're actively submitting through, let's say, MIPS measures, you might want to watch for the updated MIPS rule and take a look at maybe what measures they're looking at proposing and provide comments back to CMS on those measures. I'll also just give Kim an opportunity. Is there anything else that you want to mention about getting involved that I haven't touched on?
I think that you touched on everything, just that we appreciate feedback and that, we're continually seeking and trying to find ways to engage new folks in measure development, frontline clinicians, people that are actively submitting quality measures, that are part of the quality measures team in, directly in hospitals, patients, their families, caregivers, et cetera, so if you're, if you have any, suggestions, we're definitely happy to hear those as well. But like I said, or like Nicole said, there are multiple ways to get involved, and keeping an eye on our MMS website and signing up for the MMS listserv, is a great way to find out about those opportunities. And, if the idea of being on a technical expert panel is a little overwhelming, either from the content or the time commitment, et cetera, you can still feel free to shoot that person an email. Lots of measure developers, in addition to their technical expert panels, some of them will do one-on-one interviews, smaller focus groups, et cetera, or just take comments, ad hoc comments from the public. So, again, there's a broad, wide spectrum of ways to get involved with measure development. So, if you're interested, I encourage you to look on the website, join the newsletter, and reach out to folks when topics that you're interested become available.
One other thing that did occur to me, Kim, was also as a provider, if you are part of a specialty society or a group that represents clinicians like you, encourage them to get involved in the process as well. We do a lot of webinars for specialty societies and patient advocacy groups, knowing that they can then disseminate that information down to individual clinicians. Same, like I mentioned, patient advocacy groups. If you're a patient and there is a group that's advocating for a cause that you feel passionately about, please let them know that you would like them to get engaged with the CMS process and pass on the information on how they could be engaged and get in contact with us.
Okay. And we have a question that came in that is specific to, for CMS in particular, and how it interrelates with NQF. So, Kim, how do CCSQ and NQF interrelate, and is it better to work with one agency versus the other?
Great question. We get this a lot, and for those of you who don't know, CCSQ is the Center for Clinical Standards and Quality. That's the center that the measures management system as well as many, not all, but many of the quality reporting programs, et cetera, are held. So it's a component of CMS. So I'll broaden that question just a little bit to what's the difference or how does CMS and NQF interrelate. And like I said, we get this question a lot, surprisingly. And while we, work obviously very closely with NQF on a number of topics and issues such as the map and endorsement, et cetera. Many of their, reports are funded through CMS contracts, et cetera. We are two separate entities that serve two very different purposes. So the main focus, and Nicole, please feel free to chime in when I'm done. The main purpose, or one of the purposes of NQF is to use a consensus entity, or a consensus building entity, a body of folks to endorse a measure, and that means basically to put that stamp of approval on it, to say that this measure hits a gold standard, et cetera. That's one of the functions of NQF. That doesn't mean that if that measure gets that stamp of approval that it automatically makes it into a CMS program or anything like that. And so on the CMS side, it's not, obviously we evaluate measures as people suggest them, and we do calls for measures. We evaluate them to see if they're good for our program, but for us it's really about the individual programs and evaluating the measure to get into, so that we know whether it's a good measure or not for that program. We definitely look at whether the measure has NQF endorsement. However, that is not the sole evaluating factor for it. So I feel like I could talk about that question for 10 minutes, but we only have a couple left. So hopefully that high-level answer kind of helps answer your question. But yes, they're two different entities that, while we interact, serve two very different purposes. And so you have to look at what you're looking to achieve as to whether you would want to submit to CMS to try and get your measure into a CMS program, or whether you're looking to get your measure endorsed with that kind of gold stamp of approval.
Okay, great. Thank you, Kim. And then we're going to go ahead and we're going to take one more question just due to time. And we know that there have been many questions that have come in through the panel. So we'll be working through to address those questions. And again, we'll have a frequently asked questions document available on the MMS website that will get posted with the slides. So we appreciate everyone's questions. We will do our best to address each of them in some fashion, whether on that FAQ or get back to you. But Kim, the last question, I think it's in reference to the meaningful measures, but the question is, so is this an overarching program that tracks all CMS quality programs and tries to keep them from stepping on each other? Is that true?
So for the meaningful measures, again, it's not a program, but more of a framework to just help us kind of classify measures to get to the most meaningful measures possible, so that we have our most prioritized measures, as well as, so that we can have measures that are most aligned across the programs. If you're talking about the measures management system, that's slightly different. It's a system. We don't necessarily track all of the CMS quality programs or keep them from stepping on each other's toes per se, but more about making sure that there's a certain amount of standardization in the way in which measures are developed, implemented, maintained, et cetera, across all of the programs.
Okay, great. Thank you so much, Kim, and again, Golden and Nicole, for all of your questions and information, and to the audience for your participation today. We actually are going to be offering this session again on May 2nd. We'll be offering it in the evening from 4 to 5 p.m. in case that time is better for others to attend. So if you have colleagues that you think would benefit, feel free to send the information to them. And so again, this will be the same presentation that we did today with the opportunity to ask questions again, and then we will do a continuation with more detailed information specific to some of the regulatory processes and some of the information that we went over today. And those, email the MMS support@battelle.org email address if you're interested in getting on any of the outreach and education listservs or information that you want to get. Email us and let us know, and we can make sure that you get added. And then lastly, the contact information for those that presented today. Again, to reach Patel, the mmssupport@patel.org email address, and then Golden and Kim can be reached at the email addresses provided there. But we want to thank you again, everyone, for participation today, and we look forward to hope that you can join us again the next part of this session. Have a good afternoon.